It's winter. The weather is nice and crisp, beautiful white snow falling outside. Families celebrating holidays. Seems like a very happy time of the year. Who could be unhappy during winter except for the well-known grumpy old curmudgeon known as Grinch? If you're thinking, wait, I don't love winter. I am always sad and depressed during holidays. Am I the Grinch? Well, no. You might be among thousands of people in the Western Hemisphere who are SAD, an apt abbreviation for the syndrome Seasonal Affective Disorder, or the winter blues. Today, I am back with a new topic, Seasonal Affective Disorder, a collection of symptoms that a lot of people in the Western Hemisphere are affected by every winter. So sit back and enjoy the video. Meet Alan. Alan is a very happy and outgoing guy, life of the party and a joy to be around. He is always exuding positive energy and posting about how blessed he is in social media. Then there is Alan during winter. No energy, absent from social media except for a few occasional "I hate winter" posts. We all know or have someone like Alan in our lives. In fact, thousands of people like Alan all over the world knowingly or unknowingly suffer from seasonal affective disorder, where an individual is severely depressed during a specific season of the year, mostly during winter, over many years. A study published in Scandinavian Psychiatric Journal showed that more than 15% of the inhabitants of Copenhagen, the capital city of Denmark, suffer from some form of SAD. 15% of the population in Canada and 20% of the population in the UK have reported to experience winter blues. So, what causes the winter blues? One reason could be a chemical imbalance in our brains. Human brain cells send messages among each other via small molecules called neurotransmitters. One such neurotransmitter is serotonin. Serotonin is believed to be responsible for balancing our moods, making us happy or sad. Serotonin signals brain cells when it's released in the cleft between two brain cells or neurons. A protein called SAD transports these serotonins from the cleft back to the brain cells so serotonin can be reused and recycled. This means if our brains have higher levels of SAD, there will be lower levels of free serotonins in the synaptic cleft. Lower levels of free serotonin causes depression. During summer, sunlight keeps SAD levels low, but during winter, people with seasonal affective disorder have higher levels of SAD and, as a result, lower levels of serotonin, resulting in depression. In fact, antidepressants like Prozac work by inhibiting these SAD receptors from binding to serotonin, effectively keeping the serotonin signal on and keeping us happy. Seasonal affective disorder can also be a result of hormonal imbalance, specifically increase in the levels of the hormone melatonin. Melatonin is a hormone that is produced by the pineal gland in our brain. Melatonin responds to darkness by making us sleepy. People affected by SAD have higher levels of melatonin during winter and as a result feel lethargic and sleepy. This combination of imbalances in melatonin and serotonin levels can impact body's internal clock or the circadian rhythm. Our internal circadian rhythm is synchronized with the light and dark periods during different seasons, but people affected by SAD have a desynchronized circadian rhythm, sort of like a wristwatch on a transatlantic flight. So how do you know if you suffer from SAD? Well, If you're consistently sad and have low energy during winter, if you hate the thought of attending that virtual Zoom party your friend Ashley invited you to, but you genuinely like Ashley and thought Ashley's parties were the best during summer, you might be affected by SAD. It's okay, Ashley can be annoying sometimes. In all seriousness, SAD can have debilitating effect on people, resulting in lower productivity, severe depression, and weight gain. So, are there any treatments available for the winter blues? Well, before treating you, health professionals will first need to officially diagnose you with SAD. Professionals use a set of questions called SPAQ, or Seasonal Pattern Assessment Questionnaire, to determine whether you indeed are affected by SAD. Once you have been diagnosed, you will be treated with a combination of therapies. Professionals may suggest use of antidepressants that inhibit reuptake of serotonin, light boxes that emit a strong artificial light that mimics the effects of sunlight. They may prescribe vitamin D, as many people with SAD also have low levels of vitamin D. Doctors may also take a counseling approach using cognitive behavioral therapy. During these counseling sessions, professionals work with patients who are depressed due to SAD to break down problems that seem overwhelming by changing how they perceive these problems. These counseling sessions also aim to provide a new way of thinking about SAD mood and low energy. Also, people with SAD have reported that they have found benefits in counseling that involve meditation, therapy, yoga, and even daily walking. So, to end today's video, seasonal affective disorders affect a lot of people during winter. If you are feeling down during winter, if the sight of the first falling leaf during October starts to irritate you, know that you're not alone in this. Take some time to yourself. Allocate some time for self-care. Travel to a place with sunny weather and talk to your doctor if you can. And remember, when winter is here, summer can't be far behind. Thanks for watching till the end, guys. If you enjoyed the video, listen to Happy Ellen here and subscribe. Until next time, I'm Reza, and this was Scientastica.
Together, we're all